Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is July 17, 2025. This video is on a JAMA review published online on July 14, 2025, titled Lower Urinary Tract Symptoms in Men. Lower urinary tract symptoms in men are classified as obstructive, example weak stream, hesitancy, incomplete emptying, and irritative, example urgency, frequency, and nocturia. How common are LUTs in men? Up to 40% of men above the age of 50 years experience LUTs. Prevalence increases with age. What are the primary causes of LUTs in men? Primarily due to BPH, benign prostatic hypertrophy, causing bladder outlet obstruction and or overactive bladder detrusor overactivity. What complications can occur if lower urinary tract symptoms are untreated? Urinary retention, renal insufficiency, bladder stones, hematuria, and recurrent infections. Is it necessary to identify the exact cause before therapy? No, unless symptoms persist or red flags like hematuria are present. What is the first line management of lower urinary tract symptoms? Behavioral therapy, example fluid restriction, Kegel's pelvic exercises, and pharmacologic therapies. How effective are behavioral interventions? It can reduce the International Prostate Symptom Score IPSS by 7 points. Effects are comparable to medications in some studies. Which medications are commonly prescribed? Alpha blockers like 5-alpha reductase inhibitors, phosphodiesterase 5 inhibitors for BPH, anticholinergics, and beta-3 agonists for overactive bladder or OAB. How much improvement can medications provide? IPSS, that's International Prostate Symptom Score reduction with alpha blockers 5 to 10, with 5-alpha reductase inhibitors 3 to 4, tadalafil about 5, and OAB agents, overactive bladder agents, reduce voids and incontinence. What are the common adverse effects? Retrograde ejaculation and dizziness with alpha blockers, erectile dysfunction and gynecomastia with 5-alpha reductase inhibitors, dry mouth and constipation with OAB agents. Does combination therapy help? Yes. Improves symptoms more than monotherapy, but has higher cost and adverse effects. When should surgery be considered? For persistent symptoms, urinary retention, recurrent urinary tract infections, stones, or renal decline. First line management. Which surgical options exist and how effective are they? TURP, transurethral prostatectomy, or holmium laser enucleation of the prostate are effective. Reduces IPSS score by 12 to 15 points. Minimally invasive options have fewer side effects but more treatments or retreatments. What is the prognosis if untreated? 20 to 35% progress in 4 years. Alpha blocker plus 5-alpha reductase inhibitors reduce progression by 66%. Which patients require referral to urology urgently? Those with hematuria, recurrent infections, stones, high residual urine, or kidney dysfunction. Behavioral therapies. What is the role of International Prostate Symptom Score? It quantifies lower urinary tract symptom severity from a range of 0 to 35. A greater than 3-point reduction is clinically meaningful. How is this score categorized? Mild is 0 to 7, moderate is 8 to 19. Anything more than 20 is severe symptoms. What is the typical timeline for medication response? Alpha blockers about a week, 3 to 7 days. 5-alpha reductase inhibitors take about 3 to 6 months. And 5-phosphodiesterase PDE5 inhibitors show effects in about 4 weeks. Can patients switch medications within a class? Not for efficacy, but switching due to side effects is acceptable. When is combination therapy preferred? When monotherapy fails, or in case of mixed symptoms like obstructive plus irritative, are minimally invasive procedures effective? Yes. IPSS improvements of 9 to 14 points and fewer side effects than surgery, but more retreatments. Which procedures have the highest symptom relief? Holmium laser enucleation of the prostate, transurethral resection of the prostate TURP, and aquablation provide greatest IPSS improvement, 12 to 15 points. What are the common surgical side effects? Retrograde ejaculation up to 92%, erectile dysfunction 0 to 20%, incontinence 0 to 20%. Do surgical options differ by prostate size? Yes. Example, TURP or transurethral resection of the prostate is ideal for prostate less than 80 grams. Holmium laser enucleation of the prostate works for any size. Simple prostatectomy for anything greater than 80 grams. What are the risks of long-term anticholinergic uses? Dry mouth, constipation, and a possible association with cognitive decline. When are beta-3 agonists preferred or anticholinergics? When cognitive side effects or constipation are a concern, especially in older adults. Is there evidence for OAB agents causing dementia? Yes, but conflicting further research is needed. Can LUTs progress despite therapy? Yes, especially if suboptimal or poorly tolerated therapy is continued. What is the role of pelvic floor therapy? Effective for urgency and frequency, comparable with medications in randomized controlled trials. What is the impact of fluid and caffeine restriction? It helps to reduce nocturia, urgency, and frequency. It's a first-line behavioral modification. This is in a nutshell. Read the main article in JAMA. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.